But first, one of the devastating impacts of our COVID response is the damage caused to the health of children. By now, we all know about the mental health crisis created and worsened by lockdowns and harsh restrictions, but there are plenty of other issues we've made worse, from childhood obesity to learning difficulties. And there's also been damage done by making once healthy children immune deprived. For some weeks now, the leading cause of paediatric admissions to Victorian hospitals hasn't been the flu, certainly hasn't been COVID. It's been a respiratory illness called RSV. Why are so many more children being struck down by this illness? Well, here is Dr. Belinda Hibble.
Having less children mingling during the pandemic, we definitely have now seen that many toddlers may not have developed some of the immunity to those common childhood illnesses.
This was entirely predictable. A year ago, I quoted a paper by a team of French doctors released in May 2021 about the immune depth of the COVID-19 pandemic in childhood. These doctors had concluded that the lack of immune stimulation during lockdowns induces and I quote, an immunity debt which could have negative consequences when the pandemic is under control. The longer these periods of viral or bacterial low exposure are, the greater the likelihood of future epidemics. This is due to a growing proportion of susceptible people and a declined herd immunity in the population. Putting it more simply was microbiologist Professor Brett Finlay, who said, because of the whole COVID lockdown, kids are being immune deprived and their microbes are being screwed up. So their immune systems are a bit screwed up. Can't get more simple than that. These consequences were obvious to anyone with a fully functioning frontal cortex, and yet those of us who raised these sort of concerns were shouted down by the COVID catastrophists, who were focused solely on one health issue to the exclusion of all others.